Look, I think it's been a fantastic experience for me. It really came to the fore when not long ago I had an emergency kidney stone operation. And it was more the post-operation stuff that happened, because there was a number of complications there that worried me because I hadn't been told about what might happen. And so to be able to pick up the phone and talk to Sue, and she put me at ease and said, well, that's what you can expect, etc. It was just wonderful to be able to do that. I'd never had that before, and I've had my fair share of times in hospitals with hernias and a whole range of things,
The healthcare homes model has benefited Tony and many other patients in that when they've become unwell, they've been able to access their regular GP, i.e. myself, a lot more easily than they would have been able to previously. In the non-healthcare home system, I suspect Tony may have ended up in hospital unnecessarily, and certainly would not have been able to access the specialist care that he required in such a timely manner.
So this was really a quality improvement for the practice, to be able to bring in a group of people under the same umbrella and be able to deal with them in a different way, as well as making those people more accountable for where they are in their disease management.
So one of the things I've particularly found is it allows our nursing staff to have more autonomy to take over management of routine, day-to-day patient observations.
It has freed up the doctors to do other things. We're very heavily involved in GP training here, so it's actually helped give the GPs a little bit of extra time.
Particularly in our practice, because we are involved in undergraduate and postgraduate teaching, we actually have more time to teach junior doctors and medical students. And that's an incredibly important aspect of ensuring continuity of medical services, particularly in rural settings.
If they're a bit unsure of how to make appointments, we help them with that, help them with bookings for pathology, radiology, specialist appointments. We have a spreadsheet for our healthcare homes patients, and we track and monitor their appointments, so they have appointments with the nurses regularly.
So this was a really wonderful experience to be able to have this direct line to someone that I knew and who knew so much about me and my medical history, and was able to relate and put my mind at ease. So it's been a wonderful experience.
Initially I was incredibly sceptical and didn't want to let go of being the lead carer. However, we need not worry about that. Our patients are very happy with a nurse being the first point of contact. If anything, our caring relationship with the patients has been enhanced.
I guess a psychological or emotional point of view, it makes you just feel good about how things are going. It makes you feel important. The fact that you've got not just the doctor now, you've actually got a team of people really looking after you, and that's got a peace of mind, I guess, is really the key of it. It just puts your mind at rest about your own health and how things are going. You've got again that personal touch that makes all the difference. I think it's fantastic. Seriously, it's it's almost like humanising medical care again.
Yeah, he has a great relationship with the healthcare homes team. It seems to be working really well for him.
You've just got that confidence in people, so it's fantastic, I think.